Experience at the Activa Physiotherapy Clinic was rewarding in so many ways. It allowed me to grow as a person, to work directly with vulnerable populations, and to gain practical knowledge in the field of physiotherapy. In addition, it helped reinforce my decision to pursue a career in rehabilitation, as I was able to see firsthand how rewarding it was. I'm grateful that I was able to work with such a kind and experienced physiotherapist, and she was always so eager to share her knowledge with me. Alright, so follow me. Okay. I experienced many highlights during my time at the Activa Clinic, from being able to form relationships with patients to being able to actively participate in their recovery. However, one particular highlight that still resonates with me was getting the feedback from my supervisor that had been very helpful during my shift because I was always one step ahead of her. There are many reasons why I considered this feedback a highlight. The first reason was that I was beginning to feel like a valued member of the team, like I was able to contribute my presence to helping the clinic be more efficient. Another reason was that it reassured me that my supervisor approved of me taking more initiative with certain tasks in the clinic. I had been previously shy and cautious about doing tasks without first being asked, but on this specific day, I felt like I needed to take more initiative since Barbara's husband, who usually helps around the clinic, was not available to help. In taking more initiative, I did simple tasks like clearing beds and preparing various equipments and hotbacks as soon as I noticed they would be needed. Finally, this feedback made me realize that I was becoming increasingly familiar with various injuries and conditions, as well as with their specific treatments. As a result, I was able to predict what equipment would be required depending on the injury or condition being treated, and I was able to prepare them so they could be used more promptly. This feedback was a shifting point for me because it pushed me to seek opportunities to take more initiative at the clinic, which allowed me to benefit more significantly from my overall internship experience. A major barrier I faced while working at the clinic was the language barrier. The physiotherapist, her husband, the massage therapist, as well as many of the patients spoke Polish as their first language. Although I usually did not have issues with comprehension when Barbara or any of the staff spoke to me in English, the issue was more related to often being left out of conversations. This became especially problematic when Barbara was interacting with her patients in Polish. In these instances, I could not understand what conditions or injuries were being treated and why specific modalities were being used. This issue was difficult to address because it would have been unfair of me to ask Barbara to speak to these patients in English if they were more comfortable speaking in Polish. So, to overcome this barrier, I began to ask Barbara questions after she was done talking with the patients to clarify what the condition was and why specific modalities were being used. I found this was very effective and that Barbara was always open and willing to explain. This barrier could not necessarily be prevented because it was the nature and culture of the clinic, but the best way to prepare for this type of barrier would be to be confident and ask as many questions as possible. I have always been drawn to jobs that allow me to interact and work directly with people, such as being a sales rep, a hostess, and a waitress. I feel that I thrive in these types of jobs because I love being able to help others and form relationships with people. I also think that many of the skills I gained from my experience in these jobs are transferable to not only physiotherapy, but any job in rehabilitation. Two skills that I gained from my past work experiences that I was able to transfer directly to my work during my physiotherapy internship were multitasking skills and active listening skills. As a waitress in a busy restaurant, multitasking skills are crucial in order to maintain efficient, organized, and high-quality service. Since it wasn't uncommon that I would be required to take orders, run food, clear tables, and bill as many as 10 tables at a time, it was important that I was able to hop from task to task very quickly and effectively. An important aspect of multitasking that I gained through my experience in the restaurant industry was to not allow heavy workload and stress of performing several tasks at once compromise the performance quality of each individual task. I was able to transfer this skill to physiotherapy in order to deliver the same efficient and high-quality service to patients who came to the clinic, especially when it was fully booked. For example, as you can see from my journal entry 26, one busy day at the clinic, while Barbara was doing an initial assessment for a patient who arrived late, she asked me to count the exercises being done by a patient, to make hot packs for another patient, and to clear the beds and equipment that had just been finished being used. A common scenario in which I had to use multitasking skills during my internship was when I was interacting with many patients at once and trying to perform various tasks. In this situation, I wanted to respect the patients by actively listening to them, but I also needed to complete the duties required by me from my supervisor. Through effective multitasking, I was able to accomplish both of these. Active listening was a very important skill that I developed as a result of my retail and hospitality experience. Active listening requires one to focus solely on the customer, to listen for key information and key feelings, and to clarify the speaker's understanding of their needs. In retail and hospitality, active listening was beneficial in building rapport with customers as well as helping to quickly pinpoint the customer's needs and desires in order to match them with the best products or services. I was able to transfer my active listening skills to physiotherapy in a similar manner in order to build therapeutic relationships with the patients, to consider their subjective feelings, and to assist in prescribing treatment and exercise programs that would fit their specific needs. By actively listening when patients were explaining their conditions to Barbara, especially during initial assessments, I was able to assist Barbara in problem solving when it came to diagnosing the patient. As you can see from my journal entry 23, I was able to actively listen when Barbara was explaining certain conditions and their treatments, so I could help in designing a better exercise program for a patient. An important strength I feel I have in the field of physiotherapy is that I genuinely care about the health and well-being of every patient. It is rewarding for me to know that I can help to improve the quality of life of an individual by actively participating in their recovery process. I think that patients were able to see that I cared for them, which made it easier for them to trust me and allow me to participate in their treatment. As seen from my journal entry 22, a regular patient who was initially hesitant to let me use ultrasound on her was more willing to let me use this modality on her near the end of the year when she began to know me better and felt like she could trust me. Nevertheless, throughout my internship, I realized that some patients may be feeling nervous about letting a student use treatment on them, so I made sure to never pressure or look negatively upon any of the individuals who did not want me to be involved. The most important thing for me was knowing that the patients felt comfortable and that they were getting the best quality of treatment that they deserved. I feel that being genuinely caring for the patients was a personal strength of physiotherapy because it allowed me to form trusting relationships with the patients. In addition, it gave me the intrinsic motivation to persist in the face of struggles. To maximize this strength, I just tried to get more experience in healthcare as well as participate in more volunteer work. As stated in my journal entry 19, I was able to work well independently when I was asked to manage the in-clinic exercises of a patient. And as a result, the patient was satisfied by her session. Working as part of a team requires the ability to be respectful and understanding towards the other members, to be able to share the workload, and to be a reliable member. I was always working alongside of the physiotherapist, so this was an important strength to ensure that we were always working efficiently together. As you can see from my journal entry 21, I was able to be a reliable member of the team when I noticed that Barbara did not attach the equipment properly on the patient. I reassured her that she could always depend on me if she needed to. To maximize my strengths to work independently, I should try to seek more opportunities to take initiative, and to maximize my strength to work well in a group, I should try to expose myself to various team activities such as sports. Despite the strengths that I feel I have in the field of physiotherapy and rehabilitation in general, I do have many areas to improve. I think a major area of improvement for me would be transferring my knowledge of concepts like anatomy, exercises, and specific conditions into practical settings. More specifically, being able to verbally communicate this knowledge to patients. As you can see from my journal entry number 11, there is one instance during my work at the clinic when I really struggled in this area. This happened when I was performing shockwave therapy on a patient and they asked me, "What does this machine do?" and I wasn't able to explain it to them effectively. Even though this was a fairly easy question, my answer ended up being way too complex and disorganized. The importance of being able to communicate complex concepts using plain language is that it allows the patients to gain a deeper understanding of their condition or injury, as well as understand why certain treatment modalities and exercises are being prescribed to them. In addition, knowledgeable patients will be more likely to comply with exercise programs, as well as less likely to partake in risk-taking behaviors. Both of these will be extremely beneficial in preventing re-injury and speeding up the healing process. Future considerations to improve the effectiveness of communicating concepts to patients would be to write down the concepts in plain language ahead of time and to become familiar with this way of expressing them. However, the only way to really improve in this area is to continue to be exposed and challenged in clinical and practical settings. Another area I found I needed to improve was related to always being too gentle with patients. As you can see from my journal entry number 9, being too gentle with the modalities due to being scared of hurting the patients actually had a negative impact on the treatment. Because I didn't apply enough pressure during shockwave therapy, Barbara had to redo the shockwave so the treatment was effective. That being said, being gentle with patients with delicate conditions can be beneficial, but it's also important to realize that sometimes the saying, "no pain, no gain," is actually true. To improve in this area, you have to be able to understand what injuries can tolerate more aggressive therapies, and that even though the patient is not comfortable or in some pain, you might actually be helping them in the long term. My internship experience at Activa Physiotherapy Clinic was so much more than I expected, and I would gladly do it again. Despite the language barrier, I was able to gain valuable insight into important aspects of physiotherapy, and as a bonus outcome, I was able to experience and learn about the Polish culture. What I recommend for future student interns at Activa Physiotherapy who might be worried about the language barrier would be to simply be patient and not to be afraid to ask questions.